For years, the Old Anchor Health Centre provided accessible and convenient appointments for patients requiring a range of care, and in particular, acute sickness care. But when the surgery was taken over by the Stokewood Group last year, it withdrew this care availability, forcing elderly and vulnerable people to travel nearly 2 miles further to the Stokewood surgery for their same-day and urgent appointments. But, according to campaigners, this has left frail and unwell patients having to pay out for extra bus or taxi journeys. Local pharmacist Sid Zijani explained the strain this decision has placed on the area.
Bishopstoke is a growing village, there's an ageing population, we're getting bigger, and therefore to have a satellite surgery here, which is open for routine conditions or diagnosed conditions, not acute ones or general appointment ones, means that somebody somewhere has taken a business decision to turn this into a satellite surgery as if this was a satellite village, where actually we need more doctors, not less. The people I feel sorry for are the surgery staff as well, because they're taking on a workload that they weren't expecting. The staff of Stokewood, the patients of Stokewood now have more inconvenience because they have to now also have the patients of Bishopstoke, and the capacity has not been thought in, built in, or been pre-planned. And to add insult to injury to everything else, when we have a load of patients waiting for help, we can't get through ourselves. So we have to end up giving emergency supplies, even if surgery tell us not to, because the last thing I want is patients to go out without that medication. So even if the intention is not to allow patients to suffer, the unintended consequences of turning this into a satellite surgery with no general appointments and acute conditions means that patients are properly and inconvenienced and basically very unhappy about it. It's a very dire situation.
So what needs to be done for this standoff to be resolved?
3 things. First of all, it would be lovely if the patients could be consulted. The NHS is the jewel of our crown. It's a taxpayer-funded service. We're all entitled to it. Nobody's been consulted outside the doctor's surgery. And therefore, that would be righting a wrong. Actually ask them, do you want it to happen? If the answer is no, then what they need to do then is try and work out a solution locally with the clinical commissioning groups and with the other local NHS bodies to try and develop a surgery that's fully functional, not just pick and choose what services they want to provide and send people and pack people up to Stokewood or the Fair Oak if they need an acute or you see a doctor over a condition over their child, their elderly parent or themselves. And the third thing is maybe possibly have even more doctors down here, because we are a growing population. We used to have the equivalent of 1.5 GPs down here, and it was working, but we now need more because there's more houses that have gone up. There's a big nursing home that's just been finished. So actually we need more doctors, and nobody's consulted with anybody, not even us as a healthcare professional in the community.
And if changes aren't made, Sid is clear on the ramifications for the Bishopstoke residents.
The minute you take out a doctor's surgery, just like the minute you take out a post office, it becomes like a ghost town. And what's happening is a business decision has been made. This is regardless of what's happening to the NHS nationally. This is adding insult to injury by denying patients access to a GP for acute and general appointments. Most of the time, there's still a surgery up there for routine diagnostics or for people with or for specialistic clinics. That's not something the people of Bishopstoke have asked for. There has not been a consultation. No voices have been listened to, no voices have been heard, no voices have been asked for. And that to me is logically insane. In the land of common sense, this is lost. And whoever came out with this idea, it should have been assigned to the compost heap of bad ideas, because it's not going to work. So the bottom line is local health will suffer, because people then won't go to the local doctors because they don't want to travel up there, and they'll end up in A&E because they've let the condition worsen. Or we have to keep taking up the slack that is not really our role. Our role is to look after the public health, social well-being and the medical situation of patients. What we're doing now is chasing up prescriptions on behalf of patients, giving emergency supplies so they don't run out. We can't get through to the doctors, and it's a big mess. And doctors are not turning up even to this local surgery. In the last three months, there's been 9 to 12 occasions where we've had no GP. So whatever they're trying to do, it's not working. And even if they are trying to do it, it's a bad idea.
According to West Hampshire CCG, the Old Anchor contract closed 2 years ago when the Stokewood surgery picked up the lease. In a statement, they said, "Stokewood and Old Anchor surgeries are fully committed to all their patients. The surgery is upgrading their clinical and waiting rooms, installing new check-in equipment and new flooring. The practice is actively looking into expanding their routine clinics at the old Anchor and will keep patients up to date with developments. We are working with Health Education England and the Wessex Deanery to look closely at the workforce in primary care. Ben Treppus for That's Solent.